Thanks for being here. I want to talk more about addiction and what it is. For example, a lot of people don't know what is addiction. That's a deep concept. Imagine a guy comes down in a spaceship from Mars and he says, you guys have all these problems with drugs and alcohol. What is this? And imagine yourself trying to have the role of explaining to someone who doesn't understand what is addiction. So if you don't mind, please read out loud, Understanding Models of Addiction.
Okay.
Paradigm.
Paradigm.
Fancy word, isn't it?
Thank you. Yes, thank you. An example, a model, a lens through which to view something, a pattern.
Okay, please continue.
Everyone has their own perspective when describing something complicated. When three blind men attempt to explain an elephant after touching it, the result is confusing. One touches the foot and says it is large and round like a tree stump. Another touches the tail and says it is like a snake.
Oh boy.
Another touches the face and says it is like a giant. They are all telling the truth from their perspective. However, they only understand a part of the animal.
That's deep. Now please continue. Let's talk about the moral and spiritual model first, if you don't mind.
Okay, the moral and spiritual model. If you really wanted to stop, you would. You're self-indulgent. This is a vice like cheating on your wife or gambling. It's a choice.
And what's the solution for this one?
Find your morals. Find God, you lost your way.
Have you ever heard addiction being referred to as a moral or spiritual problem with a person? Like, for example, someone says, if that guy would just go to church more often and believe in God, he would stop abusing drugs or alcohol.
Yes.
Yeah. We can see guys on late night TV preachers, right, all the time talking about, you got to find Jesus. Jesus can stop your addiction and alcohol problems. And so imagine back in the 1920s and 1930s, if a woman had a husband who was drunk all the time and blowing all his money at the bar, where would she go to get help?
Like a treatment center.
But back then they didn't have any though, by the way. So they go to see the preacher, right?
Okay.
Or the pastor or the rabbi, and they say, here's the deal. I have a drunken husband. He's out of control. He's blowing all his money all the time. We have no money for food. Go get him help. And so 5 o'clock in the morning, they come to the house, they wake the guy up and say, here's the deal. You're going to be at church every Sunday. You're going to be at Bible study every Wednesday. And by the way, we're going to go to all the local liquor stores and local bars and say, don't serve you.
Okay.
Like a mini intervention, like a mini form of treatment, right? So let me ask you an important question. Is it possible you can be an alcoholic or an addict and still have pretty good morals or values?
Yes.
Absolutely true, right?
Yes.
I bring you to Brighton Hospital right now. I'm using Brighton as an example. And we bring it into the group room. There's going to be about 4 or 5 women in there. They're housewives from Birmingham or West Bloomfield, and they are strung out to the gills on Xanax and Adderall. However, you can leave your purse there. You can talk to them. They won't steal your shit and they won't lie to you, but they're completely drug addicted. Let me ask you another question. Is it possible if you keep abusing drugs or alcohol, you can begin to break your own morals and values over a period of time?
Yes.
Right? And we talk about people that actually get into like heroin or cocaine, turn a good girl into a prostitute, turn a good guy into a bank robber. So over a period of time, it seems to make your morals worse, not better.
Agreed.
And I ask you a question though. Is it possible you could have really bad morals and really bad values and not be an alcoholic or an addict?
Of course.
How about Bernie Madoff? What about that guy?
Great example.
Is he a good person?
No.
Hell no. You trust him with your money?
Never.
Yeah, he stole billions of dollars. He never had a drug or alcohol problem. So remember, some of the worst people in our society don't have drug or alcohol problems.
Right.
That's powerful. What about the next model there? Number 2.
Psychiatric, psychological model. Early life traumas cause addiction. Psychic cause, not enough love, abusive family.
And our solution for that one?
Go back to the past and treat the psychological trauma.
Is it possible if bad things happen to you in your childhood, physical, mental, or sexual abuse, that might play a role in addiction?
Yes.
Yeah. Is it possible you go off to Afghanistan, right, and you're a soldier, you watch your best friend get shot next to you? Is it possible you come back with that trauma that can cause addiction?
Yes.
Yeah. Here's what's important. PTSD and trauma plays right into addiction's hand. Imagine really, really bad things happen to you, and those memories keep popping up into your psyche. All of a sudden, someone gives you a needle, you put the needle in your arm, and all that psychological pain goes away. And they say, well, don't do that every day, you're going to get hooked. You're like, man, I'm in a lot of emotional pain. And so if you really want to prevent addiction in America, the main focus should honestly be on preventing physical, mental, and sexual abuse, especially with children, right? People that are abused in their youth have the highest rates of addiction. Let me ask you another question, though. Is it possible to have bad things happen to you and still not become an alcoholic or an addict?
Yes.
Right. What about Oprah Winfrey? What do you know about Oprah Winfrey's story?
Very little.
Well, she was poor and black and she was from the South, right? And about age 13, she was molested by her uncle and she was pregnant at age 14. What are the odds of her becoming a billionaire?
1 in a billion.
Right, there you go. And so here's my thinking on that. What's different about Oprah Winfrey? We call it resiliency factors. There's something about her, the way she deals with reality. She's very spiritual. She always had a very strong support system behind her. She has a sense of purpose in her life, and that's very important. But most of the people who have those kinds of bad things happen to them are not going to become billionaires.
Right.
Cool.
She's driven.
Right, exactly right. How about the environmental model?
The environmental model. Social learning. Bad people showed you how to get high. It's the problem of peer pressure and poor surroundings. It's these people, that area, easy access to drugs.
Now, a solution for that one?
Geographic cure, social cure. Leave that place and those people alone and you will stop using.
So guess who loves this model?
Moms.
How'd you know that? Every mom comes to see me and they say, my kid is so innocent. My little young man, he's a little angel. And it's all the other kids in the neighborhood that are forcing him to smoke marijuana. And you would say what to that mom?
I would say it could also just get worse.
Right? And by the way, you can actually end up putting that kid in West Bloomfield. They all say, Hazel Park is the problem. It's that environment in Hazel Park. And like you said, it can get worse in other cities, right?
Right.
And by the way, make sure your son isn't the ringleader, isn't the major drug dealer himself, right?
Right.
So that's an important question. Is it possible the environment plays a role in addiction?
Yes.
Right? And imagine if I grew up in an inner city, right? There's a liquor store in every single corner. People are using drugs and alcohol in an open air drug market. They're selling drugs, they're using drugs. I walk past people that are high all the time. Imagine me as a teenager. I get off the bus. I have to walk past a gauntlet of people that are abusing drugs and alcohol. Is that fair?
No.
Not at all, right? If I keep coughing on you and say, hey, don't catch a cold, Julie, is that fair?
It's disrespectful.
Yeah, it's also insulting, right?
Right.
It's to play the thing. The environment always plays a role. Let's go even deeper, though. Is it possible that you could be born with the worst options ahead of you because of your predisposition? We call this genetics, right? Let's say your mom was an alcoholic, your dad was a heroin addict, and from the moment you're born, you're adopted into a Mormon family in Utah. What's different about those odds for you being successful by being born and taken to that Mormon family in Utah? What's different about that?
Your environment.
Right. And so they don't use drugs or alcohol, don't even use caffeine, right? And so you can have the worst predisposition, but if you never abuse drugs and alcohol, you can never become an addict.
That's true.
Thank you. How about the existential model?
Conceptual model relating to the unique experience of human existence. Condition, people with no sense of purpose or destiny are prone to anxiety, addiction, laziness, insecurity, and fear of death.
Okay. And the solution for that one?
Discover your purpose or destiny on this earth, and you will live a life of meaning and purpose. Those fulfilling their sense of purpose have no use for intoxicants.
Well, that's pretty powerful. So you got to have a sense of purpose. I'll give you an example of this model with regards to my friend Paul. Trust Fund Paul is a guy, when he turned 26 years of age, his dad bought him a $300,000 house, gave him a $30,000 car. He gets $3,000 for the rest of his life every month in a checking account. When Paul's father came from Poland to America, his goal was to have his son and daughter never have to work the rest of their lives, right? So when Paul turns 26, his dad had him set up with a wonderful trust fund. What do you think happened to Paul within 2 years?
He threw it all away?
Yeah, became a major alcoholic and major addict, right? Paul smokes pot every single day, drinks beer every single day, eats pizza almost every single day, and masturbates almost every single day. And so at some point, I kind of confront Paul. I'm like, Paul, you're throwing your life away. You have no sense of purpose. Please stop smoking weed. Please stop drinking. Why don't you get a girlfriend? And Paul looks at me and goes, dude, I don't want a girlfriend. All girls ever do is complain about my pot smoking. Because they're fucking supposed to. Women have a civilizing effect on men. If it wasn't like for women like you, all the men would be dead, right? Women tell us, stop swinging around on that tree, come home by 5 o'clock, eat your broccoli and brush your teeth. Women are the glue that holds our society together. Is that making sense?
Yes.
All right. How about this disease model?
The disease model. Genetic, psychological predisposition, symptoms just like a disease, mental, physical, legal, and social consequences.
That's a lot, isn't it?
It is a lot. Insurance.
Billable,
thank you, model. AMA model.
American Medical Association.
Removes blame and is treatable.
And the solution for that one?
Stop the cause of the disease using the symptom.
Get it right.
Consequences will go away.
Right. So basically, addiction is a disease because it's got symptoms and it's treatable. This is very important. It's also testable. You can actually bring somebody into an interview, scan their brain, and say this person has an alcohol problem or this person doesn't, right? It's got symptoms and it's treatable. And it's also even testable. What's important about the disease model, it removes stigma. There's a lot of stigma to addiction, and people are actually ashamed to get help, ashamed if their son or daughter has it. What we're trying to do in the future is that, imagine mom comes into her workplace, right? And she comes in there and she's got tears in her eyes and she goes, my son has cancer. He's not doing very well. Imagine all the women in that office, or men in the office, rally around her. Like, what can we do to help? Can we do a fundraiser? Can we go visit your son in the hospital? They're really supportive and really positive. But imagine the scenario when a mom comes into the same workplace but says, my son is a heroin addict. Everyone had the same reaction. Imagine everyone rallies around that mom. Your son is a heroin addict? How can we help your son? Can we get him into rehab? Can we do a fundraiser? Can we help him? We got to break the stigma. The stigma is killing people. It's causing people harm.
Exactly.
So which one of these models is right and which one is wrong?
They're all right.
You're kidding me. And by the way, you now know more than 80% of people working in my field. You now understand that addiction is very complicated. If you had a friend that came to see you and they said, here's the deal, Julie, I have an addiction problem, but it's really kind of like the moral model and the spiritual model. You say, well, maybe you should get more spiritual. Maybe you should go to church and get some help that way, right? Believe in a higher power, get a connection with a higher power. The person goes, well, it's number two. It's that psychological model. Really bad things happened to me in my childhood. And you could say, well, guess what? You probably have PTSD. Let's get you to see a really good psychologist. Let's kind of help you through those issues. Let's kind of help heal your inner child. Imagine a person goes, well, it's number three. It's the environmental model. Julie, all my friends abuse drugs and alcohol, and it's really hard for me to stop. I'm like, okay, let's work on getting you some new friends. Let's work on, dealing with peer pressure and social pressure. Person comes to see you with number four. Julie, it's existential. I don't have any sense of purpose for myself. That's why I'm smoking weed and eating pills all day long. You can sit down with that person and say, well, let's find you a sense of purpose. Let's try to find out what you enjoy doing in your life. Right. And the final one is that disease model. We're going to remove the stigma and help people heal.
Right.
So now you know more than 8% of people that work in my field.
Well, I'm honored.
Thanks for working with me on this.
Always.